how can someone like improve their metabolic health from your experience? Any 3 pointers you want to give them?
Pay attention to the most important thing. Uh, Oftentimes people get dragged down the nuance and they think, okay, well, I need to, I heard the study about glycation. And if I do this specific like this specific supplement at this level or this drug, that it will tweak that just, 10%. That when most people are starting on their health journey, they just need to focus on the most important things. One, are you eating appropriate and well formulated nutrition? Are you eating a healthy diet? It may not have to be a ketogenic diet, but are you approaching your nutrition mindfully to consume foods that are going to make or improve your health, or at least not put you at risk for health deterioration? That's number one. Number two is physical activity and exercise. If you were to put the pillars of health, nutrition is certainly one of them, but exercise is absolutely another. We were made to move. And when people sit and are active or inactive for long periods of time, it clearly has negative implications for people's overall health. And so when people can get up and start moving more, almost all the evidence says that there's almost no setting where exercise shouldn't be done. Even in heart failure patients, they have done studies with high intensity interval training, again, under supervision, of course. You just don't go do something like that out of the blue. Someone who has heart failure, you just don't run at, max speeds, but it's just going to show that those people saw health improvements. And almost all the evidence says that the more physically active you are, of course, in a safe way, over time, the healthier you will be, the lower your risk are for other diseases, the longer you may live because of the lack of having other diseases on your health span. The third thing that often has a remarkable impact, but most people don't really pay attention to, especially in the developed Western world, is sleep. And when we talk about the three pillars of health, one, two, three, that hold up the foundation of metabolic health, it is nutrition, it is exercise, but I would also put sleep in that category because the lack of it is consistently associated with negative implications in health, also impacts how people consume and eat food, also impacts their desire or ability and the response to exercise. And so that is a huge implication on overall health. And it's often, in many people, dysfunctional, and people don't even realize it. They may over caffeinate or have too much stimulants, and then they're on this terrible cycle of not sleeping. So those three areas are critically important. And before anyone really should be talking about anything else, they should be trying to address those three components first. It's equivalent to trying to put new rims on a car, or a shiny sticker or a bumper plate on a car that doesn't have an engine, doesn't have a chassis or an axle or wheels. Like you need to have an engine, you need to have a chassis and the foundation of that vehicle, and it needs to be functional. Then you can start worrying about the other details along the way of what ultimately can help improve even beyond those three pillars, and also specific to you. Because even if someone tells you, hey, this is the optimal approach, then you have to do it for your health. Realize that ultimately, one, you need to try it, because if you never try it, you'll never know. You have to try it. That's number one. So take the first step, give it a go. Then you have to ultimately find out, does it work for me? No matter how much someone is telling you this works and it's amazing, if it doesn't work for you, you have to listen to your body. And so trying and then adapting, try and adapt until ultimately you're finding what works best for you as a person, because we're all slightly different in different ways. And in science, we provide recommendations based on the average of how people will respond. But at an individual level, we know that these interventions and approaches are going to have variable effects on individuals, and each person has to find out how it works for them and trust how they respond to it ultimately, because that's going to be the most important thing on their individual health journey.
Excellent. And doctor, there was one audience question from Twitter, and this is regarding it's a personalized question on the person is a type 1 diabetic and is a vegetarian and is using keto and wants to know that how should I weigh in my dietary fats when calculating basal insulin?
So, so number one, most people don't think it's not often you hear someone who's also vegan and or vegetarian and doing low carb. And this person illustrates it is possible. I've definitely known some athletes who were interested in doing that for either um, a number of reasons. It isn't always health reasons. It might be their own personal philosophy in life why they choose a certain diet, right? Uh, but so fat does have an effect on insulin levels, particularly in type 1 diabetes for sure. And fat typically at higher and higher levels ultimately appears to blunt the impact of insulin to a degree. And so ultimately, for many people, they need to be conscious of that effect, right? So if you look at a lot of studies that show co-administration of fat with other nutrients, whether it be carbohydrates or protein, you see that it reliably alters the glucose curve, and in some cases can have a powerful effect on and insulin as well. And how that appears to be happening is, number one, fat obviously slows down the digestion of the food in the stomach. But number two, fat can have at least higher in higher and higher levels, a dose dependent impact on how effective the insulin is in the tissue or on various tissues. And so it is, number one, something to be conscious of. And the most important thing, because obviously I don't know this person, I can't necessarily give them clinical advice. What I can say is a pretty universal tool, no matter what, is you have to pay attention. So when you try something like what type of fats are you attempting to measure or implement, you need to understand why are you doing it? What's the reason? Are they trying to improve performance? Are they trying to lose weight? Are they just trying to get glycemic control? If they're trying to induce performance, then they need to think about the type of fats they're consuming when they're consuming them around exercise. And also ultimately the insulin response to that. If they're doing it to ultimately get glycemic control, then they need to consider the interaction between how fat, when mixed with other nutrients, is going to affect glucose curve and ultimately the insulin requirements of that glucose curve, because it will change not only how glucose assimilates into the blood, but also the effectiveness of the insulin that's administered. And that also appears to be on how much they're consuming over that period of time. So it's quite a nuanced question, actually. For myself, what I typically do is there's a key difference between consuming a food with a lot of fat versus, obviously, like extreme example is consuming like a protein-based shake that has virtually no fat in it versus having a whole foods based like something like a steak where it has a lot of fat in it, particularly something like a ribeye or some other type of meat that has much higher fat. And in this person's case, maybe they're consuming if they're vegan or vegetarian, maybe they have a lot of coconut or some other type of healthy fat that is, consistent with a vegan or vegetarian approach. And they're consuming that with their protein. They do need to be mindful of the volume of that fat. They need to be mindful of what they're consuming it with. Because if it's, for example, if I were to be consuming something like, let's just say, this is an easy example on a vegan vegetarian approach. If I'm consuming some type of healthy plant-based protein and it's 50 grams of protein, I eat the plant-based protein by itself. And then I have coconut milk with it to kind of give it an enhanced flavor or fat profile, something like that over here. And I had, let's say, 50 grams of fat with it. This will absolutely change the type, it'll change how quickly that protein gets into the body, and also how effective the insulin is with that protein, because protein is going to have a more delayed, prolonged effect compared to glucose. But when you add fat to it, it does change that curve, and it also changes how potent that insulin would be. So you have to be mindful of that and just be conscious of the fact that it can change the amount of insulin administered often, and the kinetics of the glucose response as well. So if you see changes in glucose, you see changes in how much insulin you actually need, that's not unexpected. In fact, that's completely expected based on the science.
Thank you. I do throw in a bit of MCT oil in my protein shake just to manage the glycemic control better.
Yeah, so MCTs, for people who are unfamiliar, are medium chain triglycerides. They rapidly digest in the the stomach ultimately are converted in the liver rapidly to ketone bodies. And so if people are interested in this combination of ketones plus healthy fat interaction, medium chain triglycerides are often pretty cheap too, depending on where you buy them from. You can buy, the Ferrari of MCTs, or you can just go get some regular MCTs as well. They're basically the same. Although it depends on who you talk to. Some people disagree with that statement, but ultimately, they are a healthy form of fat for many people. Only thing to be mindful of MCTs is that MCTs, if you consume very high levels quickly, can have GI intolerance issues. And so if you are going to introduce MCTs as a fat source, I highly recommend you slowly introduce it into the diet. Otherwise, you might have some unexpected GI issues and want to be close to a bathroom. So be mindful of that and take your time with introducing MCTs into the diet.
Absolutely. Thank you. And Dave, any questions before we
Uh,
wrap it up?
no questions. It's just been an amazing session. I love hearing you talk. Yeah, I was worried that you might be talking in a sophisticated way, and it might be not something an audience can relate to. But you absolutely nailed the point. You got it like in the simplest form possible, and I'm pretty sure everyone will enjoy it.
Well, it's an honor to be here, guys. I truly appreciate it. And at its core, I'm a patient myself. I'm an individual who wants to be healthier. I want to perform better. I want to live a high quality of life, independent of my disease in general. I want those things, period. And so I never went into the journey of science because I wanted to understand why this enzyme affects this. I did it because I was fascinated to understand why things were happening in my body. Why was I seeing this change, or why is this affecting me this way? And how do we, one, understanding that alone provides powerful tools. Because, for example, I often used to ignore fat, like your listener's question was. I'm like, I ignore fat. I was told by my doctor it doesn't have any effect on my glucose. Well, when I actually understood science and became educated on science, I realized that's not true at all. Fat has absolutely effect on my insulin requirements. And the type of fat, when we administer the fat, what you administer with, all these things matter. And you never see that more potently than in the context of type 1 diabetes. And so I just became fascinated with how science and biology, physiology all interact together to provide this powerful opportunity to learn so that you can ultimately apply it into your own life. And so for me, that's really what it comes down to. If you do all this advanced work and science, from people ranging all the way from those dealing with chronic metabolic diseases to the best performers in the entire world, what does it matter if someone doesn't actually able to take that and apply it into their life? That's why I do it. I'm fascinated because I want to see the end user, the patient, the performer at the end of the day to live a better life, because that's what it did for me. When I walked into my doctor's office for the first time and had a powerful effect of how nutrition and exercise affected my life, it was very clear to me how powerful these approaches could be. But that's what stimulated my interest, was actually seeing the impact of it. It wasn't necessarily, this biomarker went up or down. No, the only reason I cared about that biomarker going up or down is because I felt better. I performed better. I interacted better. So it affected my life and today in this moment. And so that's why I care. And that's ultimately at the forefront of my mind at all times with the science we do. No matter how complex or complicated it gets, it's very important for people to understand how to take that and utilize it. And that's why a lot of what I do is, and that's kind of a main goal of mine, is to put out information it's helpful, and almost all of it's free. I don't know anything that's paid, actually. That's all out there for people to utilize and absorb. And my website is one of those places I've tried to dump almost all of that information for people to get. It's not completely updated yet, but if you pay attention in due time, you'll see there's a whole bunch of new information out there. Again, just to help people on their own health journey.